So I am absolutely delighted to introduce Dr. Debrah Wirtzfeld, who is the Associate Chief Medical Officer for Physician Health, Diversity and Wellness with Alberta Health Services. She is a professor in the Department of Surgery. She's practiced as a surgical oncologist for over 20 years. In 2019, she was recruited to Alberta as the Associate Chief Medical Officer of Physician Health, Diversity and Wellness and Professor of Surgery. She served on boards of the Royal College of Physicians and Surgeons of Canada, the Association of Women Surgeons, and the Canadian Association of General Surgeons, the latter as president and past president. She's developed and facilitated many seminars, workshops, and retreats focused on physician leadership. She's a Canadian Certified Physician Executive and a Certified Corporate Board Director. She completed an Executive MBA with a specialization in Management Consulting and Marketing in July 2019. Debrah has a passion for developing leadership potential in physicians, including communication skills and tools for allowing physicians to develop and lead high-performing teams. And I can tell you personally, she's been an invaluable source of support for me. So without further ado, I will hand it over to Debrah.
So thank you very much, Norman, and it's very much a pleasure to be presenting to you today. I presented something similar to this to the section of neurology. So for those of you who may be in that section, this will be familiar to you. And really a lot of what I'm going to present today does have basis in different types of evidence-based science. So it's not just my thoughts that I'm presenting today. It really is something that I think that we need to consider. So I'm going to be looking at this from the standpoint, the title is Becoming a Better Leader, Lessons Learned from COVID-19. Certainly these are things that people can apply in their everyday lives, and I would hope to see a lot of these things, which I am seeing to be more prominent now, to survive once we're through COVID. And when I talk about leader, I'm talking about all of us. We all have the potential to lead through some of the things that I'm going to speak to. So welcome today. So this is my disclosure slide. So I do have relationships which have a commercial interest. None of them impact on this today. I'm co-founder of several companies, but specifically Inspire Mindset MD, which may have some overlap. And as Norman has alluded to, I do work as an employee for Alberta Health Services. So when we think about the pandemic and what this looks like, a lot of people whom I am mentoring or coaching at this time are really coming to the forefront and saying, along with the goals that I have in my everyday life, and this may be academic or otherwise, I also want to make sure that I can get my team to the other side. So people thought about this before COVID, but we're seeing it being a lot more prominent now. What do I actually have to do to ensure the health, safety, welfare of my people as I get them to the other side? And this pictograph is something that my operational partner within AHS put together for our portfolio, and really looking at when the pandemic ends, what will that look like for teams? And so as leaders, as individuals who are seen as leaders, I think that this is an important thing to think about. And certainly we see this in Norman and other leaders who really are caring for their groups during this time. And I'm sure you are feeling that. So the purpose of this is really threefold. And it's to appreciate that team leaders, people on the team, should be supporting the wellness of others during COVID-19. And as I said, hopefully out beyond that. The psychological and health effects of COVID-19, I'm sure that we are going to experience for many years. So we have to really be aligned with keeping our minds open about how that looks. Describing the different types of grief that can happen on teams and how team members can support each other during COVID-19. So one of the constructs that's out there in the literature and HBR and otherwise, the Harvard Business Review, is that we can all do this on the individual level, and that grief is probably being experienced by everyone to some extent and in some form. And then looking at resilience, when we speak about resilience in medicine, and I certainly can speak to this having practiced as a surgical oncologist, trauma surgeon for over 20 years, is that the resilience we tend to think of in medicine is aligned with just bury your head down, push through it, and eventually on the other side you will come out. We don't say whether you will come out okay or not, but the Eastern tradition of resilience really has some other constructs which I think are important and are gaining more evidence in the literature. So with this type of presentation, it's not based obviously in the technical aspects of what each of us do in our daily lives. So I will often ask people to commit to 2 actions. There are a lot of things in here and a lot of things you can do to support yourself and your teams. And so I would hope that people would think about what they might take away. I just put this slide in here because I think it really speaks to the fact that when we are speaking of leaders in this area, leading wellness of our teams, that it is really each individual who has some ability to do this. So this is a wordle. If you ask 100 people on the street, what words do they think of when they think of leadership? These are some prominent ones that come up. And so we don't have to be a named leader. We don't have to be a section chief. We don't have to have some type of title to be a leader in this. And we know that the system, the outcomes we hope for our patients are tied to the strength of our teams and the wellness of our teams. So we need to be aware of these constructs. So the first area that I alluded to is really looking at wellness and team function. And I put this slide up here. The references are at the end of the talk. This was taken from a paper by Tate Shanafelt. Many of you may be aware of his research. Originally, he worked at the Mayo Clinic, and now he's at Stanford as their chief wellness officer. And really looking at, when we talk about burnout, what are some of the things that we see on a professional level, and what are some of the things that we see on a personal level. And the recorded rates of burnout in medicine range anywhere from 30% to about 60 or 70%. And I think we have a very strong ability to support each other in this. But it means that we have to be open about it. We have to be willing to discuss it. We have to be vulnerable about it. And so I think that as people are going through COVID, going through other things in their lives, I'm not naive to the fact that COVID isn't the only thing out there impacting individuals. And so I think we really have to be thinking about these things. Coming at it, some people have more of a focus on the personal side, others on the professional side, but certainly opening the conversation more around this. So this is a paper that Tate Shanafelt had put together several years ago. Again, many of you may be familiar with this information. The Mayo Clinic every year will survey their physicians. They survey many of their different groups. And this was a paper that was put together through a survey of almost 4,000 physicians. And the response rate was very high, as it tends to be at the Mayo Clinic. And what they looked at was a composite leadership score index of physician leaders, and they correlated that with measures of physician burnout and satisfaction. And all of these measures had certainly been previously validated. And what they found was that for every 1 point increase in their composite leadership score, and I'm going to speak to what they mean by that on the next slide, there was a 3.3% decrease in burnout and a 9% increase in satisfaction. So these are physician teams led by physician leaders. And what do we mean by a composite leadership score? And certainly more and more these things are coming out in the literature. The traditional concepts of leadership teams, which we saw back in the 50s and 60s, where you had a penultimate leader who dictated what the other members of the team were responsible for, is really not found in the particular things that we're coming to see more now as leadership, as being supportive in growing individuals, in growing teams, and making sure that teams are functioning. So these are some of the ideas behind the composite leadership score that leaders, and again, I'm using the term for anyone. It doesn't matter if you're section head, chief, department chair. It's anyone who wants to ensure that those around them are doing well and are growing as individuals. And informing, including feedback. There is a lot out there about how to appropriately give feedback, bi-directional feedback, feedback which makes people self-reflect. The end of the feedback cycle, the aim of it being that people should reflect on what they've done and improve next time. And so it's not really in a punitive mindset, it's more in a growth mindset. And so engaging members to help solve problems, we're seeing this a lot in COVID because we have less bandwidth, I think, overall as individuals. But the more you bring people into solving the problems rather than just telling them the solutions, the more that they're going to feel to be part of a team and the more their wellness will be positively impacted. The last three are really around, again, those constructs we associate with developing others through mentoring, coaching, inspiring others to want to do more, and recognizing people for who they are, coming into a relationship with individuals at where they are able to move forward rather than what we expect for them. And so I always put this slide in my talks. This is a depiction by John Maxwell, who's well known within the professional business world leadership realm. And if you notice at the bottom of the pyramid here, this really depicts the 5 levels of leadership. And it speaks to your ability to impact change. I have often heard, and I do think within medicine, we have this idea or construct that people should want to move up the ladder, want to be in particular named positions. When you achieve a named position, I'm sure for many of you who have had positions before, we know that this is the lowest level of leadership, which means that people follow you because they have to. When I have led teams before, there are always these people who they follow you. They sometimes try to get around you, if you will, because they don't necessarily like you or agree with you, but they follow you because they have to. And as you move up the pyramid, really what the basic constructs are behind this as individuals, as named leaders, is that people follow you more because they want to. They're starting to see that you're trying to do things for the organization. You're producing results. And the penultimate 2 levels, people development and pinnacle, are because people see that you have put your efforts into changing the system and developing people. And so everyone can be concerned with these types of leadership traits and doing things in this way. One thing I think that's important when we talk about wellness of individuals and teams is recognizing that with COVID and with other types of change, that we don't end one thing and then go simply into another thing. We're not going to simply end normal as we saw it before COVID and go into post-COVID. And certainly, I think the first step in that is recognizing that post-COVID is not going to ever be the same because the world is changing as it would have during COVID, and certainly it has changed as the result of COVID. And there are many emotions out there that members of your team may be feeling. As we come down into what's called the pit of despair, as people recognize the change or transition that's being required of them, mostly emotions we would consider to be negative. And then moving up and out to new levels of performance, we see in people that they accept a new beginning. And so really as individuals who care about those around us, we should be recognizing that these emotions may be coming out in people during COVID and other things, and that we have to really be empathetic as to the fact that people will go through these phases and we need to be there to support them. One of the ideas that is very prominent in the literature around wellness right now is the idea of surge capacity. And surge capacity is a collective collection of adaptive systems that are both mental and physical, and that humans draw on for their survival in acute situations. And so this may be around some type of natural disaster, etc. The basic tenet here is that surge capacity is limited. It's for acute situations, trying to just, if you will, this is more the construct, I think, of putting your head down and using everything you have mentally and physically to get through something. These were not meant to be long-term methods, if you will. And so we have to be aware that different people on the team will be, if you will, coming up for air at different times, and we need to be able to support that. That moves really into an idea as well about the concept of grief. And there has been a lot written during this time, including a very pivotal article, influential article by the Harvard Business Review that the title is That Feeling You're Feeling May Be Grief. And really, it's about supporting that idea that during this time, everyone in the world basically is having some type of grief. And as a physician, you are not excluded from that. Having practiced as a physician for many years, I know this in myself. I see it in others that we tend to say grief, and some of these things are things that other people experience, but they're not things that we can allow ourselves to feel or that we should feel. And I think that that is going to actually add to what we see. So I'm just going to stop there for a moment, and I'm just going to hand it over to Narman and ask you to put in the chat room what types of grief are you seeing around yourselves in your professional, maybe your personal lives. What types of things are affecting you?
So colleagues lashing out at others or belittling, people who have withdrawn. I'm seeing a lot of anxiety personally, loss of control, loss of social interaction. That's a big source of grief. Some of these are behaviors that are transmitting, like bullying, a lot of emotional exhaustion, and lack of motivation. Anger by friends and colleagues, depression, anxiety, substance abuse. Personal loss. I grieve the chance to interact with my older parents. I see them getting more frail. Harassment and tears. On that front, on the latter, I have. It's been really heart-wrenching. I have seen colleagues come into the office and just tearful from exhaustion more than anything else. Inability to deal with ambiguity. Impatient colleagues critical without considering all circumstances. Fear, uncertainty, isolation, fear. So isolation and fear seem to be very common themes here.
And thank you, everyone, for putting those thoughts in the chat box, for being vulnerable around some of those things. I know sometimes as physicians, it's not easy for people to reach out. And I think that when we talk about grief, there are numerous types of grief that people have written about. And some of those are outlined there and fall into some of these categories as well. So we think about grief, we see anticipatory grief. We see that mostly referred to traditionally when someone may be close to death in themselves and in others, in anticipation of that and the grief that is out there. And I do align with the individual, or perhaps there were more, I can't see the chat box, who spoke to their aging parents. And my parents are very elderly, live in a different province. And what does that look like if I might never see them again? So anticipatory grief is there. Disenfranchised grief is one that is very common in medicine. And this is where you have a situation where you know that something that has happened should have some type of emotional response, including empathy, grief, sadness attached to it, and you're not allowed to feel these things. And it is seen on both the individual, I think, as well as the professional level. EMS has certainly done a lot more around this than we have. And we see that in things such as the second victim syndrome, where I may be in the emergency department, I may run a trauma code, a very significant code, including many different interventions to try to save a young person. And afterwards, I may be affected. And I talk to others around me and they say either, that's part of the job, or suck it up, or these types of comments. And, I think that having grown up over 30 years in a surgical environment, I'm also guilty of having said those comments because we somehow see it as a way of making ourselves stronger and allowing us to get through. And really disenfranchised grief, where the event and the emotion are not aligned. Over time, repeated episodes can really lead to grief and despair. And complicated grief is the situation where obviously, as an individual or a friend or a colleague, you cannot be the ultimate support because you see in others that they actually need to have some other type of professional support. And there's a lot more coming out around mental health. Bell Let's Talk Day is in 2 weeks, and around seeking out help as being a normal idea around every person. At some point will need help. Others will need significantly more help, perhaps because of mental health ideas, and to really allow the discussion around that. So how can leaders, again, anybody on this call can be a leader in this supportive wellness. So being aware of grief within yourself. You can't be seen as a leader or a person who is the penultimate person who doesn't feel grief or despair while helping everyone else around you, because people will wonder whether or not it is normal if they don't see it in their leaders. So being able to self-reflect, being able to normalize it for people, saying, you know what, there are some days when I just cannot do this either. And those days may be longer than just 24 hours. And really building a proactive culture of support. This is something in my discussions with Norman that I have been impressed that she really focuses on, and that's the fact that the team should be strong, the team should be supportive before you go into things like this. Of course, we're seeing a lot of different things happening during COVID, and those teams which weren't strong beforehand will not be able to as successfully build themselves during COVID. So I would hope that as COVID waxes and wanes as well, people bring together and try to put some time and effort into saying, how are we going to build and support our teams? And then understanding the full range of grief emotions. I put the slide in previously about the descension to the pit of despair and coming back out. But there are a full range of grief emotions. We're not going to see everybody crying. We're not going to see everybody sad. And one of the ideas around this is that if you see someone who typically is a particular way and they're now different, something which isn't in line with how they normally are, then that is an area where you need to reach out. And people will not be going through these typical Kubler-Ross constructs of grief all at the same time. And in fact, some people may have anger and they may go to denial, they may go to, I've seen it in at least one colleague who typically is not humorous, who is now telling more types of jokes and thinking about, is that normal for them? So being able to reach out and accept that everybody is having difficulties from time to time. So we're not saying to people that you should be a grief counselor and you should be spending all this time in your office counseling others. That's not the purpose of who you are as a physician, but finding a safe space, having a bit of time, and participating with curiosity in people who you're concerned about. I see that you are different than you normally are. What does that look like to you? Can you tell me a bit about that? And knowing that if people seem to need more supports, we have the physician and family support services through the AMA, which is a fabulous support system. Within that organization, we see other supports that people can access. And so being able to reach out, but know that you are there as an individual support, but shouldn't be that person's main support system if it seems like they are perhaps needing more support. The last thing that I wanted to speak to, and happy to break at any point, Norman, you can just break in if you have comments or questions that are coming. Resilience as a construct over the last, I would say, 15 to 20 years is having a more significant impact on how people think about it, what people are recognizing both from a psychological but also from a medical standpoint. So in the chat box, Norman, I'll hand it over to you and the group. What does resilience look like to you and on your teams?
Hope, communication, infinite patience, maintaining a perspective of the big picture, flexibility and adaptability, self-care, expressing yourself. I would add to that expressing yourself is feeling heard. I think that it's one thing to express, but not feeling heard can just, sort of add to the insult. Ability to adapt. Oh, suffering in silence. Oh. Asking about each other. Yeah, I think that's a really important one. I know for me personally, I think for most people, for especially mothers, caring for others can really help to allay sort of your own challenges. Ability to adapt again, showing up each day despite adverse circumstances. Over optimism, perhaps. Yeah, I think optimism is a fine balance, and I've had this discussion with Debrah before about feeling like I always have to put out this optimistic front. And of course, those of you who know me know that I'm an optimistic person by nature. But there are times where I think that putting out too much optimism can actually be insulting. And so there I think is a fine balance probably in that as well. Seeing the better side of the situation, being able to laugh when you're invited to a resilience training seminar at 7 a.m. on a Saturday and coffee is not provided. Ability to sustain and embrace life. Allowing others to feel heard. Yes, I agree. Resilience to me is multifaceted. There's personal resilience where you can engage in self-care, but equally important is the system in which you work. We need resilient workplaces and government systems to allow individuals to be more resilient. Speaking of self-care, on a positive note, I heard on the CBC this morning that hair salons were going to open up on Monday. So I just put it out there. Finding purpose. Resilience is the ability to be vulnerable yet bounce back, perhaps even stronger. And finally, avoid temptation to try and do too much.
Yeah, so those are all great ideas, and I probably don't need to give the rest of this talk because the constructs are coming out there. But I just hope that in the next few minutes as we talk about this, it becomes apparent that the traditional construct of resilience, just put your head down, just suck it up, just move forward, is not really one that is well supported either by Eastern doctrines of resilience or by the literature. So there are 5 basic tenets that if you consolidate the literature around resilience, which seem to be important, and you've touched on all of them in your ideas in the chat box. So the first one is belonging, that people need to feel that they belong to a group, a team, even a small body of 2 or 3 individuals. And so I think that it's important during this time that people reach out, even form a small group if you're not part of a group that's already clearly defined, and meeting regularly and being able to just share whatever is coming up for you. This doesn't have to be at a formal level. This doesn't have to be a section head. This doesn't have to be someone else in that capacity. It may be just 2 or 3 people that you feel comfortable with and that you have some sense of belonging in. There's no defined construct for who belongs to this. And so really seeking to belong yourself and bringing in others to belonging. There's a lot of ability to communicate and to be around people. I think sometimes we just think we're too busy for it, and this is not a time to be lost in that. This is very important, and I alluded to it earlier, and I think the studies will show that certainly those people who have a growth mindset are more resilient. This is the work that started with Carol Dweck, talking about the success that people have, both in terms of their overall professional life, but also in terms of just being healthy and productive individual. And there are the two different constructs of a fixed mindset, which is that people believe that you have a certain amount of skill or intelligence you're born with and that cannot change, and that you really function within a fine range of your skills. And so people in this mindset might say, well, physicians are physicians because they were born that way and they eventually find their way to being physicians. Whereas a growth mindset is that you have the capacity to grow throughout your life, and that you can gain skills and that you can learn from your failures. You should not be afraid of failures. We're seeing a lot of different things happening right now in the environment where things are being tried because we haven't lived this before. And so really not stepping back from that, in learning from it, not from stepping back from failure. And so I think that it certainly has been shown that people who have a growth mindset are better able to withstand difficult times, and more evidence around the fact that people can grow throughout their lives, not just in what was formerly thought to be the plasticity range of younger individuals. Acceptance is one of the five, and knowing when you need to persist. Obviously, there's things that must be done for the system, for patients. We don't each individually need to do everything, knowing when to individually persist, when to turn to other people on your team or pivot what you're doing, and when to punt something. And so really recognizing that I think within physicians, we sometimes feel, if this doesn't get done by myself, it's not going to get done. I'm the only one who can do this perfectly. No one else understands what I'm going through. And so really trying to put some of those ideas aside and having acceptance for the things that we can change. Sorry, I see someone raise their hand. We'll get to that question in a moment. I'll have Norman read some of the questions. So someone alluded to hope. I think it's important for everyone to think about their own hope, as well as to think about how to bring hope to those around them. And we know that there has been many people speaking to the fact that our predecessors have lived through things which may even be more significant, may be worse than what we're living through now. The human species has survived through those and will likely survive through this. And so we need to, as a group, be aware of what brings us hope, and really bringing it down to those simple things that may be lived on a day-to-day basis. I might hope for the hair salon to be open. I might hope that I'm going to share a conversation with my son on the weekend, and not put our hope all in the fact that we're going to put our heads down and eventually one day we'll be able to come up, because we will not probably even know that we are at the end of the pandemic until we reflect back and see that we are at the end. So having hope in the smaller sense, day-to-day things, what you want for yourself, what you want for those around you. And yes, somebody did bring up humor. It actually has been shown that people who have a sense of humor and can use that sense of humor to help themselves and others actually are shown to be better able to bounce back. As someone used the traditional definition of resilience, which is to go through tough times and to bounce back stronger and bounce back quicker. And so when I meet with people and have some of these discussions, this is the one I tend to get the most pushback on. And how can we be humorous in this time? I think that we need to find some humor. So there are numerous ways you can do this, and I would just put that out there to you. So resilience is really, as I said, by the definition, bouncing back. And this is really the construct that these skills can be learned. It's not that certain people are resilient and certain people are not. I think through medical training and getting to where we are, we've all shown certain aspects that we can be involved in things which we see as detrimental or negative, and we have survived through those things. And so we all have the skill and the capacity. And the only difference between those who keep getting up after adversity and those who struggle is knowing how to draw on resilience. So this can be taught. This is a skill. We can work toward that. And I think putting that out there, just several people in my discussions have said that's really helped me just thinking about that. And so here are some of the things that I just want to put out there that people have been talking about in supporting resilience during COVID-19. Many of these you did allude to in the chat box. Expectation management. This is a big one. Many people who are in medicine have huge expectations. They have huge goals for themselves and others, and just being able to manage those expectations. I use a personal example with people that when I had my children and I was home with my children, my expectations went from achieve full professorship, write 2 papers in this period of time, etc., to get up, brush my teeth, and feed myself, so that I could have some sense that I was actually living through a difficult time, but I was actually able to succeed in it. So expectation management, very relevant right now. I think we're seeing a lot being written around certain groups of individuals who may have difficulty in the academic setting. This is around women in medicine and others who have to assume different roles, including childcare during this time. And what are our expectations going to be of people to continue to do what they traditionally have done in an academic or clinical setting? So thinking about that for yourselves and for others. Showing up, this is not only in your attitude and some of the things we talked about, hope and humor, but also self-care and attire. Showing up to Zoom meetings fully dressed, with your shoes on, your teeth brushed, your hair brushed, that can certainly lead to greater resilience. Flexibility. We have a lot of discussions right now about if people work from home, how are we going to ensure that they're working from 9 to 5? And there are some of us who say it doesn't really matter when or how they work as long as they're getting it done. Some people work better in the middle of the night. So being flexible about how people bring themselves to work and do things. Having a to-do list, that's great, but having a to-be list. We're seeing more people really reflecting on who they are as individuals, what they want from life. Are they truly aligned with what they've been doing in the past? Productivity blocks. This is important for the virtual world. People are looking at what is the maximum in productivity, and usually no more than 2 hours, and needing a break after that. So really trying to look at how we're fashioning that. Having an endpoint, we talked a little bit about that in terms of hope, and having an endpoint not for a week, having it for a day, not saying the end of this will be COVID when it's over. We need to be thinking about different endpoints, and also looking for confidence in chaos. There are all those, in all of us, there are those people we know who seem to ride out storms very well, and we need to attach ourselves to those people who actually bring that to us. Who are those people that you can look around to who always make you feel better when you're done? And so really drawing yourselves to them and not getting lost in the chaos that is the gossip about things that are going on. I leave the last few slides here around circle of control, because this is a very strong tenet in resilience, and that's the fact that we have a lot of things that we're concerned about. One of the things I would bring to the forefront is the vaccine, and I understand this group specifically around the vaccine, and a lot of things that are being done by people in this group, frontline workers, what that looks like. There's also a circle of influence, and some people in this room may have greater or lesser influence to change things around that. I certainly have felt in my role as I've been speaking to physician wellness and what that looks like around the vaccine, that I have had very little influence in this. And so the circle of control is really for your wellness, the wellness of those around you, focusing on what are the things that you can control. And so you can control speaking out, you can control advocacy. And I think we are seeing some impacts that people are hearing this. So really controlling the amount of energy you put into things and thinking about things that you really can't control. This is certainly well supported in the literature. So I'm going to end with a few slides. Those who have a why to live can bear almost any how. So I think a lot of people that I've been mentoring or coaching at this time have been thinking about, they've been in medicine for a while, maybe even a short while, and really coming back to why am I in medicine? Because that is really what is going to be impactful in terms of people getting through this. I am not going to show this video. It's a TED Talk by Simon Sinek. Many of you may have seen this. He's a thought leader in the important tenets of building teams and moving them forward. It's important that we all know our why. There's many ideas we talk about how we're going to roll something out, what we're going to do, but if you're not sure of your why, it's probably going to be detrimental to your wellness and health during this time and to those around you. So what is your why for what you're doing? And just to show this slide, there's many different things that people have been looking at in the brain, many different connections, biochemical factors that seem to be associated with resilience. But there is more evidence over the last 10 years that certainly resilience is associated with greater connections between the prefrontal cortex and the amygdala. So there actually are anatomic correlates of those people who are more resilient. And it has actually been shown that an increase in the strength of this is likely related to things such as living in the present, the practice of mindfulness. So I know that 15 years ago, even now in this audience, there are people who are probably rolling their eyes when I talk about mindfulness, but there is more actual physical evidence that mindfulness is tied to actual anatomic changes associated with those who are more resilient. So I leave you with that and the three areas we talked about: supporting wellness, supporting the management of grief, and what does resilience look like? I come back to this. Perhaps some of you say, it's enough just for me to listen to you this morning and I'm not going to do anything further, and that's fine. Again, how do we get our people to the other side? And happy to take questions.
Thanks, Deborah. That was amazing, as I knew it would be. I have a question to ask, just related to, for a lot of my section chiefs, site chiefs, and division directors and myself, we know that, there are individuals that will reach out and ask for help, will come and talk to us and let us know sort of what they're going through and what they're feeling. But there's equally a number of individuals where you just cannot penetrate, and it's coming out as behaviors, and it's really difficult to touch those people, and those are probably the ones that aren't on this call, right? Or at this round. Do you have any words of wisdom or any advice on how to get through to that population of individuals where, maybe they haven't come to that self-recognition of needing some support?
So I think that's a great question. And I would just relate it back to when I was section head of general surgery in Manitoba. And, I had never until that time had so many people who I saw as being very resilient, able to weather any storm, come into my office and absolutely break down in tears. And I was shocked by this. And I think that it became apparent to me over time that some of the people we see as being either most able to weather these things, or their behaviors maybe switched something different, switched to what we might think is disruptive, are the people who are actually hurting the most. So I think that it's very incumbent upon us to actually in some way reach out to these people
it's very difficult, I think, in medicine, depending on your level, to be able to reach out. I think that we have more ability as people who are section heads, department heads, to say, you know, can we talk about this and start to open up and say, I want to have a discussion with you. It's not around condemning you for what's happening. I want to talk about what is underlying this. How are you hurting from this? What are you seeing? Is there something I can help you with? And I think we tend to reach out more in the vein of, you can't do that, stop that, rather than actually trying to reach out and be empathetic. And I think we're scared of the response that we might get. We're scared either from the fact that someone's going to say, well, I'm going to end my life, or we're scared from the fact that they may yell at us. I think we have to get past that. I don't think it's going to be an easy answer to that. I think it's going to be people being vulnerable in their own skin and reaching out to these individuals. That doesn't excuse behaviors. There will be some people who say to me, well, you know, I'm acting this way during COVID because I'm under stress. And it's obvious that their response to me when I've been asked to speak to them is one of excusing their behavior. But I think most people, we've all had that situation where we've had behaviors where afterwards we've thought, you know what, I'm not the best person out there. And recognizing that these behaviors happen to everyone. We had something else we did in general surgery in Manitoba where we brought in a consulting group to help us with developing our professionalism. And we had this thing that was called Below the Line, where we all agreed as a group that when something happened and someone thought your behavior was culturally inappropriate or unacceptable, you could just say, that has made me feel below the line. And then it would just stop. And we agreed to that as a group. And when we started, it was interesting because everybody was like, well, you know, the other people are going to be the people whose behavior is bad. And there wasn't a single person who didn't get at least one below the line, right? I remember my first one from a resident in clinic one morning, and I just went, oh, yeah, okay. So it's a recognition that there aren't good people and bad people, but that there are variants of people, and accepting that most of the behavior we're seeing right now is probably a reflection of grief, fear, loss.
There is a really thoughtful question about power differentials that I'll just read out here. Thanks for the talk. Leadership most times carries a power differential between the leads and the governed. This often leads to burnout masking by those who are more junior in order to save face and avoid being labeled as malfunctioning. What tips do you have to allow for more vulnerability among leads between themselves and to penetrate that through the ranks to the more junior positions? How to allow upstream and downstream feedback and allow safe space for everyone despite the power differential?
So this is an excellent question, and it's a very difficult question. I think it has probably answers that are easier than they are to actually implement. So where we are in our current lives, we don't remember where we were previously. And so it's difficult for us to see when we say to somebody who's very junior, well, just speak up, right? And so I think it really lends itself to the fact that the people who are the most senior have to be the most vulnerable in this. It's like when we talk about issues of diversity and inclusion and people who are in certain less privileged groups having to push things forward. Well, the people who hold the most power are the people who are responsible for leading the change. And so I think it has to be through the discussions that we have where people are seen as vulnerable themselves, where leaders say, you know what, that was a huge failure on my part, or I just went home last night and I lost it. I either, you know, ate that gallon of ice cream or watched those 10 episodes of whatever, or just sat on the couch and cried. I think we have to, as leaders, accept, and now I'm talking about not individuals as leaders, but named leaders and those who are seen as having more power on the hierarchy, to be able to say, I did this, it's okay for you to have done that. it's difficult, but when we think about the suicides that we're seeing during COVID-19 and the fact that we're all here and we're all working for our patients, but we're so isolated and we feel so isolated, as a group, we need to accept that that's not appropriate. We need to be vulnerable. We need to reach out. It's not a sign of weakness to reach out. And I can say that because I have 25 years of being a surgeon behind me, and most people will listen when I say that, right? But I think, my email address is there. Certainly willing to talk to small groups about this. I'm sure you are. But it really is incumbent upon the leaders to recognize that they cannot just be there to answer the questions about grief. They have to show that vulnerability themselves.
Yeah, I think there's no question there is some nervousness amongst leaders of balancing that, sort of showing that vulnerability with showing, that, yeah, we've got it under control, staying calm and carrying on and, having that balance, right?
Mm-hmm.
Just to that end, on our COVID website, for those of you on the call, we do have a physician support tab where we've identified some resources, and of course, our office is always open as well. The last question I'm going to ask is actually around trust. I think I know the answer to this, and I guess I'm asking personally. In terms of building trust. So it's one thing to say, I recognize that you're going through a phase in your life, whether it's related to COVID or having very young kids, which, I, like you, have gone through as well, or certain circumstances where, there's only certain things that you're able to accomplish. And we trust that, you will get to where you want to be at the time when it's right for you. So, being a new leader, I guess relatively new, it's been 9 months now. So, how do you build that trust amongst your constituents that, will have your back? Take the time and look after yourself right now. We recognize that these are unusual circumstances. How do you build that besides time?
Yeah, I think some of what we talked about is certainly true, being vulnerable yourself and time. But I think, one of the things I tell my children, and I would tell that to other people, I'm always saying, what's good for my children is good for people I work with and vice versa, is that usually when you don't know the answer or you're uncertain, there's probably a conversation out there that you need to be having that hasn't been had. And so I think it is having the ability to have that door open that says, you may not know what you need to do right now, but you know that what you're doing is not working. If any of you are thinking that way right now, I think the next step is have a conversation with someone and just sort of start reflecting on it. Because oftentimes we get stuck in our own brains trying to figure it out. Well, in order to become full professor, I need to do this and that and this and that. And you don't have all the answers. The answers are there in the group. And that building of trust, when I talked about that pyramid and people at different levels, trust is really the basic tenet of that pyramid and relationship building. So I think that, I certainly see it in yourself as a leader. I see it in the department chair of anesthesia. I see it in surgery. I've seen it in others. That these leaders are leaders who are coming to the forefront now, who are not I'm going to lead from the head of the ship and everyone's going to follow me. But it takes a while for people to see that and to come, I think, out from under that rock that says that as physicians, we just move forward. We bury our head and we move it forward. Well, I would hope by the time that we all hit retirement, we're not just sitting as a blob on the couch because we put everything we've had and now we have nothing left. And so, having a talk with someone is the best way to define what are your abilities at this time. I don't know if others have other things to add.
There was a comment in the chat box about outward displays of vulnerability, and Bonnie Henry in BC, the medical chief medical officer, sort of breaking down, really built a lot of trust amongst her constituents. That vulnerability doesn't always backfire or decrease your role or image as a leader. So I can tell you that across the board, all the chat and in the Q&As is that this was an amazing presentation, and people are looking forward to being able to review the slides and watch it again. So we've assured them that so I think Andrea is working with you to make sure that we can get this to talk more broadly disseminated.
And maybe I can just say one last thing.
Yeah.
I think that I would like to reach out to the men in the room, because I know that some of these constructs of vulnerability, people expect it sometimes in women, and it's actually easier for us to come across as vulnerable and not be denigrated for it. So I think that the more that we accept that men are going to have difficulties with these things as well, that it's going to normalize it as a process. So, reaching out, being vulnerable, people reach out to the men around you as well, who seem to be having a difficult time, because they need our support as well.
Thank you for bringing that forward. You're right that we do often neglect that. So on behalf of the department, Debrah, thank you so much for an amazing talk. Even if it was similar to a talk you gave a few weeks ago, I think it's very needed. It could almost be done on a weekly basis. So thank you so much. Just for those of you tuned in, next week, Dr. Lauren Terrell is going to be presenting on much anticipated topic of securing COVID-19 vaccine for Canada. So look forward to seeing you all. Have a great weekend, and please take care of yourself. Thanks.